if you're employed, school, if you're a student. And so the combination of physical therapy and occupational therapy can be very valuable as a complementary treatment in patients. I put up here TENS, T-E-N-S. It's a mnemonic for trans-electric neurosense stimulation. So it's so everybody in the audience has used a TENS unit before. So a TENS unit actually can be applied, trialed at a physical therapist's office, and it acts as a distraction tool to reduce, again, the pain associated with chronic muscle spasm or even nerve pain. And it's a nice adjuvant, very low potential complications, very high yield in terms of efficacy. And then exercise. So paced exercise, graduated exercise, getting out of bed every day. Very important. And then heat and cold. I talked about that briefly in the topical therapies under medications. The use of alternating heat and cold. Heat for that chronic muscle spasm, tension, muscle tension, and then cold for the anti-inflammatory type symptoms can be incredibly effective. Behavioral modification. This still is pertinent to the pediatric population. Now, I think it really depends upon the cognitive abilities of the pediatric patient, but I think someone of 9 to 15 years old has the cognition to be able to utilize some of the distraction techniques that I'm going to talk about, and the utilization of art therapies and biofeedback. So I'm going to go over these in a little bit more detail. So distraction really is the use of a sophisticated technique where you take your mind off of listening to those chronic pain signals, perseverating on those chronic pain signals, and really focus on something that you enjoy. And so when I give an example of distraction, I talk to patients about being in a movie theater or being exposed to a movie that they really get engrossed in, that they really find interesting, reading a really good book. Just think about when you've been in that situation and nothing else has seemed to be in the environment with you. That's distraction. And so it can be utilized quite effectively. It takes practice and maybe some guidance, but it's a very powerful tool in management of chronic and acute pain. Art therapy, same. So engaging somebody creatively in a therapy that they enjoy. And it's also a outlet for their frustration or for their anger even sometimes about their situation, be it the pain or their chronic disease state. Biofeedback, again, it takes some educating. It actually takes an active participation on the part of the patient or individual to go and be trained to do biofeedback. But biofeedback allows you to be in control of your body sensations. So it will educate you on how to listen to those body signals, be it a rapid heart rate, pain in particular body areas, and be able to reduce that or control those feelings. Comedy, again, comedy as a distractive tool. So comedy, and I'll show a vignette here on the next slide, but the use of comedy as a creative outlet, but also as an engaging situation where you go to a comedy club and nothing else seems to matter because you're so focused on the entertainment right in front of you there. Yes?
I heard that when you laugh, the utilization of your ribs and your muscles here is sort of similar to exercise. That's why we vest. And there is release of endorphins. Yes. Is that true with laughter?
Absolutely. So it sounds very abstract, this statement that we make about the release of endorphins, right? Endorphins can be released with a good exercise, good stress, good distraction, and also with laughter. And so the endorphins are essentially the body's natural opiates. So if you look at opiates or narcotics as kind of making you feel good, making you feel like you can conquer the world and do anything, that's what endorphins make you feel like. That's not to say if you don't feel that way with opiates that the endorphins won't make you feel that way. But endorphins are fantastic, and helping patients kind of connect with that and understanding that is very powerful. So yes, I think that laughter also releases those endorphins. I'm a runner, and so I equate that to exercising. I don't laugh enough, that's for sure. All right, work, engaging in your work, your schoolwork, your paid work, volunteering. These are all important ways of distracting your mind, feeling good about the contribution that you're making, and also not being so focused on your pain on a daily basis. And then exercise, as we mentioned. So in the next slide, I want to share a video vignette with you. It's a young CF patient, and it's her way of expressing herself through comedy and also dealing with her chronic disease. Loading.
Do you have any stand-up comedy?
So I'm really bad at icebreakers. So my name is Therese, and I have cystic fibrosis, which basically means my lungs hate me. Every morning, you have to catch the bus, You're running, it's like 2 blocks away from your house, and you see the bus driving, and you think you're gonna make it, and then it just drives by, and you're like, no! And you're like waving your arm, like, stop! And then the bus stops.
At least the video stops at the appropriate times.
That's
Like maybe like 20 more feet down. Most people are really happy, right? Because they're like, yes, I can catch the bus. But for me, I'm thinking, oh God. Because the bus actually stops, means I have to run and catch it. So I'm running, and I jump on the bus, and I get on. Of course, I'm like hacking up a
We're semi-high tech here.
Yeah. Okay.
by this point. So the front row of the bus just kind of moves to the back, and I get the whole front row to myself. Thanks, swine flu. This also works really well.
All right, we're going to say goodbye to Charisse. And you can access her video on YouTube. We're just having some difficulty with the streaming. No fault of anybody's other than the World Wide Web. All right, so finally with the behavioral modification, the use of psychotherapy. So we already talked about how depression and decreased mood states can really make your ability to manage your chronic pain much reduced. And so some formal psychotherapy could definitely be appropriate and warranted. Formal meditation, relaxation, again, forms of distraction exercises. And if one is so motivated, can actually go and get formally trained on how to do meditation. And we will walk ourselves through a guided relaxation exercise at the end of this presentation today. Any question about behavioral modifications, complementary therapies, anything that we didn't really go into in any much detail that I can answer at this juncture? Okay. The audience is very relaxed. All right. So, not that this audience needs it, but I wanted to take you through a guided relaxation exercise. And this was also downloaded from YouTube, and we're going to try one additional time to go through this off the web. And if it gives us the same types of issues that we had with Charisse, then I will go through a guided exercise on my own. So let's see if this works.
If I
Find a relaxed position, lying down.
All right, so I think it's going to work. So what I want you to all do is uncross your arms, uncross your legs, feet on the floor, arms gently rested on your thighs. Close your eyes and just listen to the words.
As best, and get comfortable. First, relax your body. Feel the relaxation grow with each breath you take. Begin to create a picture in your mind. Imagine that you're floating on a soft, fluffy white cloud. Notice how the cloud feels. It might be a little bit cool and moist, like fall. Your body is warm, very warm and heavy, sinking into the cloud. It is a wonderful feeling. You can choose to float wherever you like. The sky above you is bright, blue, sunny, and inviting. You're warm and comfortable, warmed by the sun's rays shining down peacefully. There are some other clouds in the sky, floating gently. See them lazily passing by, far above. Your cloud can float wherever you choose. If you enjoy being high up, you can let your cloud rise into the sky. It is very safe, very calming, very relaxing. You're so relaxed, floating on the cloud, supported gently but firmly by your cloud, surrounded by the cloud's protective embrace. See the sights around you as you're floating on the cloud. Imagine the green grass below, gently blowing in the wind. The grass recedes further away as you rise into the sky. From here, the grass looks like a soft carpet, the wind creating gentle waves in the grass as if it were water. What else do you see? Perhaps some trees, their leaves whispering in the gentle breeze. You can gaze down on housetops, country roads, hills. From this amazing vantage point, you can see around you 360 degrees. The horizon stretches out in a complete circle around you. Notice in the distance how the hills appear almost blue, slightly hazy. How does it feel to be floating on a cloud? Does it sway gently like a boat on almost smooth water? Does it drift in the breeze? Can you feel the movement as you gently float on the cloud? You feel so comfortable, so relaxed. Up here, the air is so clean. Look up at the beautiful sky. The clouds that were high above you are much closer now. The ground below you looks like a patchwork quilt. Green grass, golden fields, yellow, brown, blue patches of water, rivers and lakes. See the clouds around you. You're even able to look down on some clouds. See the shadows they make on the ground below. Can you see the shadow from your cloud? See how the shadow drifts silently across the ground below. Relax and luxuriate in this beautiful scene, floating on the cloud.
So you're up on your cloud. Oh, we're not done. Close your eyes. Relax. So now they're coming back to earth, very relaxed. All of your muscles are relaxed. The tension has gone out of your muscles. You're coming back down. You're back into your body. You feel very relaxed, very rested. You can open your eyes now. So it kind of works, right? Is there anybody awake in the audience? You feel very relaxed. And again, you can go and you can do these types of treatments in a group setting. You can get examples off the internet, as I did, and actually practice the relaxation exercises at home. You can buy a soft music tape and then just let your mind wander. And it's a wonderful way to distract yourself and just release that tension.
When we had the sleep study class a few months ago, one of the physicians had mentioned about the importance, because a lot of our patients have difficulty sleeping and relaxing at night, especially when they're hospitalized, and talked about the importance of having a nightly routine. So a shower, maybe some quiet reading or listening to music, possibly your recommendation for this stress kind of management tape. I think all of these things would help facilitate. She mentioned that right before you go to bed, those things that you're dealing with sometimes can course throughout the night. Our patients sometimes worry that it's the narcotic or the Ambien or something that we gave them, but in reality, it's right before they go to sleep, their level of stress or discomfort, anxiety. And so if we can anticipate a better sleep time, I think they will awaken with more energy and possibly even less pain.
Yeah, absolutely. So the more factors that you put into a person, stress, anxiety, pain, chronic disease, these are all things that will rev up the system. Does not promote good, restful sleep. And pain is one of those factors as well. And so not only establishing a good sleep hygiene routine, but also trying to relax. So not only are you trying to relax the body, but relax the mind, so that you do get a nice transition into sleep and that you stay asleep as opposed to being woken up in the middle of the night and still perseverating and having your mind working on the various things that you're stressing about. Was there a question at the back?
Well, just that we have our online audience would like to know where they
Yes.
can find these on YouTube. So I know the first one was Charisse.
Yes. So let me see if I'm going to go back and I'll give you the URL. Hold on a sec. So can you see the URL for that one? I know it's in blue. It used to be in pink. Okay. So it's http www.youtube.com/watch?v equals 1I capital RD 45 Honestly, if you just go onto YouTube and you do a search for guided relaxation or meditation, you're going to get populated with all kinds of different scripts that you can essentially pick and choose from. And we'll go back to the Charisse and see if I can. So if you also go onto YouTube and you put into the search cystic fibrosis and comedy, you'll come up to Charisse's URL. Okay, so this one specifically, again, http /CHI, capital R, capital P, lowercase p, capital K, lowercase e, capital Y, GS. But again, if that doesn't work, just go to YouTube, so www.youtube.com, and plug in cystic fibrosis and comedy or guided relaxation.